Hello, everyone. Welcome to the session. The session is about the FMG friends who could not make it this time and how to proceed further. Uh, Very limited days are there, 20 weeks are left. It's not a very huge time, if you ask me. So, I have got the best of the people around me right now. Dr. Sandeep Sharma, our pediatric faculty, Dr. Priyansh Jain, our biochemistry faculty, and we will be keeping very to the point and crisp so that you get the meaningful information out of this particular YouTube live. I'll have a question straight away to Dr. Priyansh Jain. Dr. Priyansh, currently, a lot of people have got the result in their hand for last 1 week now. What is your, like first message to them for the people who could not make it this time?
So, good evening to everyone. If you are feeling numb, emotionally numb, not feeling good emotionally, or unmotivated, or any such feeling is there, it's quite common to happen. It's, uh, it's nothing unusual with any failure. These things happens to everyone, but that doesn't mean that we are a failure. So right now, don't push yourself that कि मुझे बहुत motivated होना है. I have to be very rigorous, very intense with your preparation. One good session and you will be on the track. But meanwhile, you it's not the time to dissect that where the things has gone exactly now, because your mind is not able in a state of that particular thing to figure it out. So let's be calm for for a moment for the next few days, and then yes, rigorous intense preparation will be required. But for the first few days, let's take it like this, and let's go little smooth with us.
Thank you, sir. Sandeep, sir, what would you like to convey to students to begin with?
Sir, my suggestion to students is very simple. Every day matters. Whatever had to happen has happened. There is no point, crying about it. I'm heartbroken. I'm feeling bad. Yes, but at the same time, we are professionals. It was a competitive exam. Somebody has to get selected and somebody will not be selected. So it is important that you remember the date. 28th June, the exam is coming. Some of you might be thinking, ki, sir, I am already behind other people. You understand one thing. Even after passing the exam, it takes roughly 3 to 4 months, probably more in some of the states, for internship to start. Suppose you do very well in the 20th June exam, result comes out in 10 days, you have cracked the exam, and your score is so good that you probably start your internship earlier. You would retrospectively look back and you would realize that there is only 2 or 3 months gap between somebody who's cleared the exam this time versus somebody who cleared in June. So life and examiner is going to give you that time to catch up. The only question is, are you ready for that hard work, that smart work to put in? Because hard work alone will not work. You have limited time available. So smart work is needed. And that is why we are here to advise you on doing the smart work activity. Rajiv sir.
Absolutely. Yeah, I totally agree with both of you. First of all, what Priyansh was conveying that it's a moment when we feel low, and Sandeep is saying that we need to bring an endpoint to the low feeling and bounce back to the, studying. And my contribution to that is I want to make everyone aware the exam is not very far off. It's 20 weeks only. If you really see, we have 19 subjects and we're already counting about the 20 weeks only, and we'll be soon reaching exam. And Sandeep is trying to show you the brighter picture that in case you get good marks, you can really get internship of your choice. I would like to ask Priyanshan sir. So certain subjects remain stronger, certain remain moderate, and certain remain always weaker. Okay. So what I could really understand from students' interaction, after the exam is over, students are also aware that certain subjects are still not okay with them. They could not revise. Now, how would you really plan your strategy if you are a student in this phase about the strong subjects, about the moderate okay subjects, about the very weak subjects? Sir? How would you decide your strategy for that,
Uh,
sir?
the strong subjects from whichever source I have read, I will continue with the same. But now coming to the weaker part and the mediocre subject for me, because the last source has not worked for out for me. That is why it is weaker. So I need to figure it out. But again, at the same moment, as you mentioned two times, that we are just 20 weeks away, we can't go for a very extensive version of those subjects. So at the same time, we have to crisp, concise, but keeping in mind the level of the exam, that the question has to be catered in that limited time frame. So my strong subjects, I will just revise them again and again with the same notes. Will the flip the page, but the subjects which I'm okay, or maybe very weak. I will figure it out that okay, what can be a concise version for me. I will reread it multiple times, and all the subjects. It's not required that you should be equally good in all the subjects to clear the exam, right? So, sir,
Yeah.
it's cumulatively 150. We have to figure it out, and I feel that if you are 12 subjects, you are very good. Definitely, you are going to make it the exam, and six subjects, seven subjects, okay, it's also fine.
Yeah, true. I totally conform with what you're saying that, like if you're subject a weaker, you cannot pick up a very lengthy source for that because at the end of the day, you will not be able to revise that again. And the week remains a week only. The idea would be best to have a specially curated content for that subject and revise that multiple number of time. But the content should not be too vast and you can't handle it. Uh, Sandeep sir, I would ask you specifically for few things like number one, you know, at this moment, people are of different category. One group is first time repeater, but one group I would keep multi-time repeater, like two time, three time, four time to seven, eight, nine times also. How the strategy should be different for the people who are repeating exam multiple number of times. Where is the fault over there, so in your angle?
Sir, multiple repeaters have three or four problems from what I understand after discussing and talking to many of them. Number one, some of them are frustrated actually because they have tried so many times. So what they do is they keep on reading the same thing again, again, again. And then they are like, I'm not passing the exam. So should I, that trust factor goes away. So that frustration sets in, trust factor goes away. At the same time, they don't have the time for, reading new classes, attending new classes, making new notes again and again. So that is one missing link, that, they can't read their existing notes again because the mind block comes into play. Second thing, some of them are not very thorough with the MCQ preparation, or they are doing it in a patchy way. Third
Yeah.
problem which multiple repeaters face is effective revision. You know about a subject, but you don't know precisely. And when a precise or close options come, then you falter because your revision was not proper. So, according to my limited knowledge, these 3 points, if you are double, triple, or more than three times, four times repeater, you have to address them. So,
Yes,
sir,
sir.
how do we go about them actually?
Yeah. Very validly said because I am in touch with people who are repeating exam multiple number of times. I have a very genuine suggestion for them. If your content is too old, actually, it is high time you must upgrade the content of the same faculty with the latest set of notes. Because you know what, I think Priyash will also agree with me and Sandeep also. Whenever we take the classes in every session, the content maybe on the superficial level it looks similar to people, but we keep adding finer points to that, more clinical things to that, and the people who have got previous version notes, they end up missing those things, and which become the reason of 140 marks actually. So I think first time repeater or multi-time repeater, there is a difference over there. One difference is the people are repeating four time, five times, six time. The old notes should be certainly replaced. Now it's high time. Do not keep on doing the same thing. Number two, your way of solving multiple choice question, maybe it was different and you could not cope up with the style of question asked the exam. Ask yourself very clearly, were you more PYQ based or were you broad based actually? So PYQ based approach MCQs making us get stuck up between 140s again. Why? Paper does not, you just give the paper. You ask yourself, how many PYQ exactly were there? they the topics may be there, but the style and the pattern, the intensity and the closeness of choice, which Sandeep is mentioning, was really different as compared to the PYQ we see in the the resources. Guys, please understand that very clearly. We want to tell you, being faculties, even that PYQs somewhere give a little milder version of the real paper. with due respect to all the resources, content hours also, whichever it may be. But PYQs end up giving you a little, easier version of the real intensity of the paper. So the approach should be now, number one, upgrade the content of same faculty if you're liking it. Number two, now go aggressive on the Q bank actually. That's why in DT we stress upon our Q bank that we want the Q bank to be really reliable source for you guys, and you should be actually doing custom modules, and definitely nobody should be missing upon the NEET PG questions. Now, when I say NEET PG questions, lot of people ask me, what do you mean by NEET PG questions actually? Because NEET PG content is here. NEET PG workbook will be 100 pages extra. Now, when I do NEET PG questions, I will be seeing a lot of extra topics over there. My dear friends, our idea over here is same topic being asked in the NEET PG style. Same topic being asked in NEET PG style would be little bit more close to the real examination over there. So, by chance, you see a very new topic over there, cotton my grading for congenital subglottic stenosis, which is a very pet topic in NEET PG. You may not, you may leave that, but if it's scenario based question over there, for example, if they say thyroid surgery done, this was cut, like this question also came this time, practice those kind of question more. It'll give more confidence over there. So NEET PG should be, style of question should be part of your preparation. And people who are repeating multiple number of times, they already have got theoretical knowledge. They can include the INI and the problem based questions. The except for the controversial question and recent nuances, I think you can go for every question over there. But make broad based question bank custom modules and do not run away from the multiple choice question. Priyansh sir, if I may ask you, if you were a student repeating first time, this time, unfortunately, we got stuck at 141, for example. How much time would you distribute between the theory revisions and the question solving, and how many questions per week approximately, sir?
I feel, sir, those who are there between 135 to 149, they know the context, they know the syllabus, they know the level of the exam, and they know the stuff actually, sir. Two things I really want to emphasize them to work on. One is the leakage. The leakage means that the avoidable mistakes in the exam, which you may, because of rushing, because of the timeline during the exam, maybe some silly mistakes, maybe not reading the question properly, maybe something means the question which you should mark right, you have made it wrong despite knowing the answers. There were around 10-15 such questions are there. So and to master them, it's more important that you do more MCQ practice and in a more structured manner, so that you will be able to control your nerves in the exam hall. And it should, when you are solving the MCQ at home, you should create the same environment like you, as if you are solving the same question in the examination hall on your computer screen. There should not be any distraction, there should not be any reference review at the same time. When you are solving the MCQ, let's solve it for, let's train your brain for 50 minutes to consolidate and control your nerves. And that way definitely those 10-15 mark additional will come. But provided that you have scored 141 doesn't mean that you just have to score 9 more marks. So again, we have to start from the beginning. We have to do the theory, we have to do everything which we have done, and this time we have to do more aggressively, because every time they are increasing the level of the exam. So we have to do that stuff again. But I would say the time has to be split around 60-40. If your score was 140 somewhere, 60% means if you are studying 10 hours a day, 6 hours go for the theory part, 4 hours for MCQ means 4 hours means almost 200 plus MCQs you should do.
Very, yeah. Totally, I think very valid point made by Dr. Priyansh that people who are in this zone, they can now decide that if they devote every hour to theory revision, we will ultimately land up again the same trouble, which we don't want to land up. So 60-40 is really the right distribution in my understanding also. And I would ask Sandeep sir now. Sandeep sir, tell us very much clearly in these 20 weeks, how many grand tests you are planning to take as a student, sir? And when would you like to stage them up?
Sir, let us be honest, most of the students who will be sitting in this exam, they have already appeared at least once. So you already have a fair idea about the exam. So my advice would be, do not wait for the last few weeks to come for giving grand test. For somebody who's starting first time, that is a different matter. But I think between 7 to 8 grand test you have to give before you sit in the exam, because there are 20 weeks, so it comes out roughly about, sir, every 2 to 3 weeks. If you can give one grand test and see the curve of the grand test, I think that is important, because grand test, again, try to give in the time limit, number one. Number two, identify after giving a couple of grand tests what are the subjects which are again bringing your score consistently down. They will give you a direction, they will give you an idea, and you can start working on that. And number three, grand test should always be, now this is a very controversial thing, sir, but I believe that grand test, there with the end of the day, you should try to give grand test of multiple platform. I'm saying this, saying on DocTutorials, you should try to give grand test of multiple platform. Reason being very simple: you have studied from a particular platform for regular videos, you are doing test series of a particular platform. Eventually what happens is the grand test also has a bias of picking up the same questions, and then people say, sir, I was getting 220, 230 in my grand test, actual exam I was not able to cross 150. Because what happens is, when you are doing only a particular area, your mind starts remembering the answers, and then the grand tests do not give you a right direction. So my advice would be, XYZ platform I have done, I will give grand test of doc tutorial I have done XYZ platform. If I get the opportunity, I'm not asking you to, definitely subscribe, but if you get that opportunity, or if there are free grand tests also sometimes made available, try to give this grand test. And about doc tutorials, I can definitely say that that we have about 7+ grand tests which are planned in the FMG Vijeta pack. In this 7+ grand test, faculty has contributed, and you can listen to the interviews of the people who have given this exam. One of them, sir, he got 213 rank, 213 score, and his Dr. Tori's GT score was 212. So it was almost the same. There are some similar interviews already there on the YouTube. So my advice again, even if not doctoral, give grand test, number one. Number two, minimum 6 to 7 you have to give. Number three, try to mix it up so that you get a fair idea where you stand.
Perfect, sir. No, no, really, I think let me summarize what you've got to, because we don't want it to be just an endless conversation. Uh, what Priyansh is saying, 60-40 is the exact distribution of the time limit between the theory revision and the MCQs. Second message from Dr. Priyansh would be that for the weaker subjects also, do not go too lengthy in the content, be precise, specific, and revise that content multiple number of times. Sandeep is average keeping the 10 grand test before the examination, which I agree. If it is fortnightly testing, 20 weeks, 10 grand test is possible, definitely. I would like to, suggest one thing to everyone. One, if you see the observation which we have after the interview of a lot of people who passed and did not pass also, which were working like with us in the DT, the daily test dose, the morning, afternoon, and the evening test, that has been actually a game changer for a lot of students. The reason is that there is 10-minute, there is a 10 question, like test, which will be only specifically opening at that specific time. And you cannot take this test after that window closes. So there is a sense of discipline, and a lot of people told in the interviews also that they were looking forward to attempt this test. They were putting alarms so that they don't miss the test. At least they will get to solve those questions, which will give them habit of solving multiple choice questions also. So please look for the reasons and the means to induct discipline within you to do these questions also. And the daily dose test is one of the initiatives we had to induct the discipline within everyone. Now, uh, next question, sir. Brian, sir, how would you think that the this Vijeta plan can help those people? We are not saying that take this over. We are saying that what we are doing as a team of 19 faculties who are really passionate to help the FMG students to pass the examination. What actually is being done on the platform, we are just letting you know about that from the faculty angle as well. Priyansh sir, what would you like to guide people? Then I'll come to Sandeep sir after that about this plan, sir.
Is as both the things, rather three things are there mainly in this plan. The detailed videos, the CPR, which is concise version, or rather super concise version, and then we have the QRP also, and along with that MCQ. And this is what is required for the exam. The strong subjects which you are really strong. If you have done with the other faculty, but you are feeling very confident with that, go with that, no problem. But the other subjects, I would suggest that you go with the QRP and the CPR part. And definitely MCQ is must, right? We can't run away from them. If you are not getting good score in GT, doesn't mean that many of the times we think that कि मेरा score कम आ रहा है तो मैं नहीं देता हूँ, मेरे को और डिमोटिवेशन हो जाएगा, ये हो जाएगा. नो, डोंट गो फॉर दैट. गो व्हाटएवर स्कोर इज कमिंग. This, don't obsess about the score. It's more about the learning part, that how we are able to the timeline, the controls, that whether we are doing the silly mistakes or not. So work on that. And as this plan is cumulative of all of them, the GTs are there, the revision part is there, two types of revision, the CPR and the QRP, both you are getting. So I would say that yes, it's kind of what is actually what is required for clearing this exam is everything is there.
So, what do you think that what is the specialty about the CPR actually? What would you keep in mind for biochemistry CPR? The critical point recap, like
One my point, two things sir. कम पढ़ना है and बार बार पढ़ना है, and I want that at least if 20 question comes from biochemistry, my idea is that I would not say 20 out of 20 will be there, but at least it has to be 17, 18 plus definitely will be there, sir.
definitely, sir. And Sandeep sir, what is your take on the the daily dose test? Do you find it is relevant, useful? Uh, what is your understanding as per interaction with students, sir?
Sir, my interaction, there is an interview I took of a girl. I'm forgetting her name. She got 207 marks and she's from Kerala. It's there on the YouTube channel. So I asked her, what about her MCQ practice? She said she was giving daily dose, and those 10 questions which were coming in the morning, evening, whatever subject I'm reading, she said I would solve those questions and I would keep revising them. And over a period of about 2 or 3 weeks, she said I had a huge collection of high yielding topics, and many similar questions, not the same, let us be honest, but similar questions were asked in the exam also. These daily dose targets, we have a morning dose, we have a midday dose, and we have a evening dose. Let us imagine you are a student who's preparing at some XYZ institute or preparing at home. Whatever you are doing. But you decide that for the next 1 month, I'm going to solve every question of daily target. How much it is going to require? 10 minutes, 10 questions in morning, 10 minutes, 10 questions in afternoon, 10 minutes, 10 questions in the evening. Whatever go wrong, you see the answer, remember them, write them in a piece of paper. After 30 days, 30 multiplied by 30, that is 900 questions you have done, separate from whatever you are doing. Small drops make a big ocean. You would suddenly realize that not just a mixed bag, but high quality questions you are doing without overburdening your preparation. All we are asking is 10 minutes in morning, 10 minutes in afternoon, 10 minutes at night. You already waste a lot of time. Maybe you decide that I will solve these 10 questions while having a cup of tea, or maybe after having a cup of tea. And then I will continue with whatever you are doing. Small things do add up. You need to understand that. People who get 200 plus, they are not, Einstein level people. They are just doing the things a bit more organized, a bit better than you. You just need to adapt accordingly.
Perfect. I think the pretty clear suggestion from our side is that daily dose test is to induct discipline, and I would now like to add certain more points to our preparation. Actually, guys, uh, please understand that whatever happened has happened now. If you think we are 149 or 148, can something be done? Let us accept it. Acceptance should come now faster so that you're able to decide your strategy for the June exam preparation. Now, this window is very, very important because till March end, you have little liberty to keep working on the weaker subjects. Whatever you were having, like problem with the subject. For example, you could not do gynae properly, but ops you could do properly last time. This is a time to work upon that. Your pharma was weaker still. You attended the sessions of pharma, but you never revised the pharma notes because it was a little scary subject for you. See, till end of the March, you have the liberty and the little convenience also to work on the weaker subject. Moment April and May will come. Let me tell you, April, May will be the second set of revision. So in March, if you're doing self-study or you are taking this plan, whatever plan, work on your weaker subjects. And as Priyansh said, like 10 hour you are working, 4 hour you devote to multiple choice question, you know 4 hour you devote maybe to your weaker subject, but 2 hour you revise your strong subject one more time. You give you a little more output on the day. For example, you're working on pharma, but in the 2 hours you just quickly see few topics of ophthalmology if it is easy for you, and then do 4 hour religious study around multiple choice questions. Okay, but April and May would be again revisions. Lot of things will be happening at the time. For example, this CPR program, critical point recap program, would be starting mid-April actually. Mid-April, then it continues to the exam actually. And in this CPR, the critical point recap means that you revise pediatrics with Sandeep sir, biochemistry with Priyansh sir, ENT with me, live in the span of 5 to 6 hours. The main points are thrusted upon you, and that PDF is shared with you actually. Okay, that is not that you have to note down. We end up sharing that PDF with you so that you are having last minute material also to revise. Then there is a most important question also being discussed simultaneously. Reason is that we want you to revise the content with us in the CPR format, and or if you want to little bit go little higher, you have got the QRPs, the 5.0 video access also. In MIQ is a test and discussion format. We'll pick up the question, we discuss why this choice was incorrect and why that was correct actually. So it's again one more set of revision only. But if you have done a lot of hard work till end of March, you would have made your weaker subject comfortably okay for you. You will be getting the best advantage of whatever resource you choose. We are not saying that this is the only resource. This is one of the resources we developed as a passionate bunch of faculties. Okay. So, but March till March is your time actually. If you waste February, March, then again in April, May, everything seems so fast over there. You could not catch up the things over there. Do not let this time go waste, everybody. I would humbly suggest everyone start working on your weaker points right from now. That would be really, really beneficial for you. And June will be last regular revision and will be close to the examination. Again, you know, I would like Priyansh sir, give something like which will help the people sail through this time actually, not just this time of getting out of this trauma. Staying organized, staying committed, and how not to predict a failure one more time, sir. Because this will be needing a lot of hand holding, sir. Yes.
Is as those who are going to give the exam, maybe second time, maybe third time, we need to accept the fact, and so this particular pain is really going to go when the word pass will be written on that paper, on that PDF again. Till that time, every day, every minute, it is going to haunt you, and it is quite normal, but we need to accept that this trauma, by thinking, by watching motivational videos, it is not going to go away. It is going to go away when the result will come positive. And for that, we have to work more rigorously, more intensely. And whatever we have did last time, maybe वो गिल्ट आ जाता ना सर कि मेरा दोस्त पास हो गया, उसने कम पढ़ा था, मैंने ज्यादा पढ़ा था, मैं रह गया. So these things, they uh, at, at one point we feel bad, right? But we need to understand, we need to accept that fact, and slowly, slowly with time, you will come on track. But it should not take more than 3, 4 days, 5 days. uh, you should start acting at least right now. Maybe may not be 16 hours a day, maybe even 6 hours a day. Have a consolidated plan and make sure that every day you are doing MCQs, every day you are reading some previously completed subjects and flip the notes fast because you know the context. It's not that you are completely blind. So let's go like this and definitely you will make happen.
Thank you, sir. Wonderful. Sandeep, sir, your inputs for the same thing actually. Any advice would you like to give to students to help them sail through and pass the examination, sir?
So first of all, keep no options that I will try my best. You have to crack this exam. And people who have cracked this exam, they are no different from you. They are not like, out of this planet people. They are very much your colleagues who have done it well. They just did, they did it better. They did not repeat the mistakes that you did. You just need to work on your mistakes, do effective revision, get the basics right, finish syllabus on time, do revisions as much as possible, one grand test every 2 to 3 weeks, MCQ practice, passive, active. Active is what you do, passive is through the daily dose quizzes, which we talked about. Why not? My simple question is, why not? What is stopping you? You've already reached 130, 135, 128, 144, 149. All you need to do is work on your weaknesses and the job will be done. And this is where again Vijeta plan comes into play. If you have already joined some place, continue with it. If you feel that you are having some problem in revision, Vijeta plan, we are not overburdening you. You can continue with your momentum. This program starts midway, live CPR, limited time. I come 6 hours. I tell you what is the most important theory thing. You get a workbook for that. Then you get a test and discussion, most important questions created by me only, me discussing the relevant points, which will be different from what I discuss in CPR. Some points will be application of that. Then you get access. You want, suppose your one subject is weak. You want to see the detailed version 5 videos, QRP version of that. That access is available to you. And we are giving you faculty curated grand test as well. And if you are sitting at home and preparing, this is again a thing I would definitely recommend. Why am I saying so? Because I am a part of it. I have contributed to my own. Priyansh sir has created the biochem part. Sir has created the ENT part. So it's not an automated AI. It's not AI. It is not artificial intelligence. It is human intelligence. So trust the HI, but trust your own ability to perform. So this is something we would definitely recommend. At the same time, it is not magic. The magic is in your preparation.
Perfect, sir. I think that was very, very apt, like advice to the students. And Priyansh, sir, final comments, then I will conclude. Anything anybody wants to add out of you, both of you, please, let us, anything I'm missing upon coming to your mind, which can help the students, because the idea of these sessions is that, you know, we understand that it's a moment of low feeling. We know, and we cannot really 100% pull you out of that, but it's our small attempt to make sure that you feel that there are people standing by your side, and that the whole team, not just three of us, we all are actually committed in a way that whosoever passes, we enjoy that success. Okay, fine, but our main concern is with the people who could not make it last time. We have to make sure that they also join the same league over there. Priyansh, any final comment before I close the session?
There is no perfect plan, sir. There is no perfect strategy that will come on the way. You start working. First thing first, let's try to come out of the drama slowly, slowly, and let's get the momentum going. And on the way, you will understand that actually the last time where the things has went wrong, and we can rectify. The 20 weeks is a good enough time to sort out the things. So you are not doing the things from the scratch. You know the context, you know the concept. So yes, but we have to work aggressively. We have to be disciplined. The sacrifice has to be there, and yes, you will definitely will make it happen.
Thank you, sir. Thank you, sir. Anything, Sandeep sir, from your side, sir, to finish?
Nothing, sir. All done. Listen to this YouTube video again so that you have an idea
Yeah.
that, because sometimes brief lapses of concentration can happen. Absence seizure हो जाते हैं कभी कभी, छूट जाता है, vacant staring group आ
Yeah.
जाती है. So just listen to it again and see if the thing works for you. So I'll say the same thing as Priyansh sir said. There is no perfect plan. Start fast. सोचो मत, रिसर्च मत करो, ये इंस्टीट्यूट अच्छा है वो खराब, वो टीचर अच्छा है ये खराब. अभी टाइम जा चुका है. एक को पकड़ो, अच्छे से करो, and give grand test. That is the only message.
Perfect, sir. So, thank you very much. And to conclude, actually, I would just summarize the if I'm a student, what I understood from Dr. Priyansh and Sandeep sir. And number one is come out of this trauma faster. Number two, be aware we are 20 weeks away from the examination. Number three, changing resources for everything is not a solution. You have to understand that using same resource, people have passed the exam also, done pretty well also. Certain subjects you may not be really happy with, you don't understand, feel free to change that. Okay. Solving MCQ is an integral part of the preparation now. 60-40 would be good distribution of time between theory and the MCQs. Being just doing the PYQs of FMG is not the solution. Be wider, custom module, including EPG question, is definitely required. Please make difficulty level moderate in your custom model design for sure. Solving 150 question, 100 question every day would be definitely helping you in on the exam day much more than theory only revision over there. And last and most important thing is please take help of your family members also. Talk to them. Whatever happen. Speak to your parents or friends or siblings or who are your core people, and take their support because you feel that they may be feeling that like you have not made it, but maybe they are waiting for you to knock their door to talk to them openly. What are you doing right this time? Just tell them very clearly, okay, I accept that there was some deficiency in my preparation. This is a plan I have in my mind. I need your support. Be open, be vocal about it, and you'll feel much better about it. Uh, Please do consider possibilities, whatever can augment your preparation, whatever can supplement your preparation. Our Vijeta plan is one of the resources we have want to introduce you because we are really passionate about it. Having said that, what Sandeep said was, it is you who will make it happen. Your ultimate efforts will make it happen. Your consistent efforts would be definitely required now to pass the examination. So let us take an early start. Let us focus on our weaknesses, and we'll keep coming back to this channel with more number of faculties so that you definitely feel that you're aligned, because mentorship is one of the most important part of the all DT programs. And we are very, very clear on this that just theoretical knowledge does not help. We need to really, prune the extra thoughts in your mind, and you keep your channelized also. So let us meet again in couple of days with other set of faculties so that we keep the journey going ahead further. Let us hope this time we'll make it big, good score. Good score means good internship also possibilities over there. Think about those things happening to you. Thank you very much, Sandeep sir. Thank you very much, Priyansh sir. And
Thank you.
good luck from our side. Please take an early start and work on your weaknesses first of all. Thank you, sir.
Thank you. Thank you, sir.
Thank you, everyone.
Nice. Good night.
Good night.